Big Cat Rescue First Aid. Basic information. If you see someone that appears to be in trouble, remain calm, ask if they need help, and if it is okay to touch them. If the person is in an unsafe location, get them to safety. In a situation that requires first aid of any kind, always radio for your coordinator and a golf cart to your location, and remember to speak clearly. Ask for assistance, give your location, and be sure to state the word immediately. Example: I need a coordinator and a golf cart immediately at TJ. The coordinator will report to the operations manager, who will report to the CEO and president. First aid kits are located in volunteer sign-in, food prep, gift shop, main office, provisions outpost, hospital, lion's lair, and the cooling station. First aid kits are stocked by Big Cat Rescue. Personal medications, such as an EpiPen, should never be stored in the first aid kits. These medications should be carried on your person or kept in your bag or vehicle. An AED, automatic external defibrillator, is located in the gift shop office in a large metal cabinet to the right of the volunteer bathroom. The AED and other needed medical supplies, one-way CPR air masks, are together in a black duffel bag. This entire bag should be brought to the scene if requested. Use gloves when assisting someone who is bleeding or vomiting. Wash hands before giving first aid if you can, but definitely after. The Good Samaritan Act covers you for helping someone prior to medical help arriving when acting within your scope of training. Heat-related illness. Encourage guests to purchase water and to stay hydrated before the start of the tour on hot days. Volunteers should always carry water during the warmer months. Tour guides and backups must observe guests at all times for signs of heat illness. Volunteers who are working or cleaning must also observe each other. Early symptoms include cool, moist, pale or flushed skin, headache, nausea, dizziness, weakness, exhaustion, or sweating heavily. Late symptoms of heat illness include red, hot, dry skin, loss of consciousness, and vomiting. Do not wait until you are thirsty to drink. Thirst is the first sign of dehydration. Drink fluids often and stay hydrated. If a guest or volunteer is suffering from heat illness, you should call your coordinator and a golf cart to your location. Then move the person to a shady spot, assist them to the ground, loosen tight clothing, and fan the person until help arrives. Once the golf cart arrives, assist the person to the cart. Have someone hold on to the person to ensure they do not fall off of the cart if they pass out, and take them to an air-conditioned building such as the Cool Cat Cave or the gift shop. Offer water first, Gatorade second only if the person is responsive. Both can be found in the Cool Cat Cave and in the gift shop. Be sure the person drinks slowly. Ask the person when they last ate or if they are diabetic. Apply a cool compress. Frozen water in volunteer sign-in, Cool Cat Cave, and gift shop, 2 pulse points. Do not put the ice directly on the skin. Put wet paper towels between the ice pack and the skin and apply to wrists, neck, armpits, or behind the knees. It is vital to cool the person down quickly. If the person refuses water, the skin is red, hot, and dry, their level of consciousness keeps changing, or they start vomiting, that's a sign of heat stroke. The coordinator will call for an ambulance. Place the person on their side, continue to cool with compress, and monitor their breathing and pulse until emergency help arrives. Loss of consciousness. If a guest or volunteer loses consciousness, you should call for your coordinator and a golf cart to your location, check for a pulse, the carotid artery in the neck, and check to see if the person is breathing or otherwise moving. If the person has a pulse and is breathing, ensure they are in a safe location and wait for your coordinator to arrive. The AED machine should only be used if the person does not have a pulse and is not breathing. If you encounter someone in this condition, you should call for your coordinator. Your coordinator will call 911. The AED should be retrieved by one person while another person begins CPR, if trained. Once the AED arrives, turn it on and follow the verbal prompts. Wounds. All staff and volunteers should be current, within 7 to 10 years, with tetanus shots, unless contraindicated by allergies. If you don't remember when you had one, get one. If a guest or volunteer is wounded, check the scene for safety, call for your coordinator in a golf cart, if needed, to your location, then move the person to a safe location. Once the golf cart arrives, assist the person onto the cart and take them to a building with the first aid kit, such as the gift shop, the Cool Cat Cave, Provision Outpost, Main Office, Food Prep, Hospital, Volunteer Sign-In, or the Lion's Lair. To prevent the transmission of disease, wear gloves and do not touch your mouth, eyes, or nose with contaminated hands or gloves. Minor wounds. Clean the wound well with fresh warm soapy water or hydrogen peroxide. Work from the center of the wound towards the outside of the wound to avoid moving dirt into the wound. Cover the wound with a clean bandage or cloth. Apply antibiotic ointment after asking about allergies to such medication. Major wounds. Wear gloves and apply direct pressure to a bleeding wound with a sterile gauze pad. Do not apply a tourniquet. If the dressing becomes soaked with blood, do not remove it. Apply additional dressing on top. Elevate the wounded area above heart level if possible, if you do not suspect broken bones. Cover the gauze dressing with a roller bandage to maintain pressure. The coordinator will determine if an ambulance should be called or if the person can be transported to the ER by staff. If an ER visit is required, staff and volunteers will be taken to the ER by a BCR staff member. Nosebleed. Have the person lean slightly forward. Pinch the nostrils together for about 10 minutes. Apply an ice pack to the bridge of the nose. If bleeding does not stop, apply pressure on the upper lip just beneath the nose. Severed body parts. The coordinator will call 911. Wrap the severed body part in sterile gauze or clean cloth. Place the severed part in a plastic bag. Put the plastic bag in ice-cold water and take to the hospital or send in an ambulance with the person. Control bleeding by applying direct pressure to the wound. Raise the injured area. If the bleeding continues, recheck the source of the bleeding and reapply direct pressure, with help from someone who is not tired. If the person has life-threatening bleeding, a tight bandage or tourniquet will be easier to use than direct pressure on the wound. However, using a tight bandage for a long time may do more harm than good. Keep the patient warm. Take steps to prevent shock. Lay the person flat, raise the feet about 12 inches, and cover the person with a coat or a blanket. Do not place the person in this position if a head, neck, back, or leg injury is suspected, or if it makes the victim uncomfortable. Impaled object. The coordinator will call 911. Do not remove the object. Bandage bulky dressings around the object to support the object in place. Bandage the dressing in place. Bites and stings. Insect repellent is kept in most of the buildings and in the tour waiting yard. If you know you have a severe allergy, carry your EpiPen with you at all times. EpiPens are not stocked in the first aid kits. Notify the coordinator if you carry an EpiPen and let them know where you keep it. Biting and stinging insects, and such common to Florida, include sandflies, chiggers, horseflies, deerflies, fleas, ticks, mites, mosquitoes, wasps, bees, fire ants, and caterpillars. Florida is home to 2 species of venomous spiders, widows and recluse, and 6 species of venomous snakes, southern copperhead, water moccasin, eastern diamondback rattlesnake, timber rattlesnake, pygmy rattler, and the eastern coral snake. Insect bite. Symptoms of an insect bite include stinger present in the skin, pain, swelling, and possible allergic reaction. Remove the stinger with a pair of tweezers or scrape away with a stiff card. Rinse the tweezers off before and after using with either warm soapy water or hydrogen peroxide. Wash the wound, cover, apply a cold pack, and watch for signals of allergic reaction. To stop itching and stinging from an insect bite, sprinkle a little accent powder, yes, the one used for cooking, on a moistened gauze and apply to the bite. Accent is located in the gift shop and in food prep near the first aid kits. Try to avoid scratching the bite. Spider bite. If bitten by a spider, try to remember as many details as possible of what it looks like. Do not try to catch the spider. Symptoms of spider bite include bite mark, swelling, pain, nausea, vomiting, difficulty breathing or swallowing. Wash the wound, apply a cold pack, and seek medical attention to receive antivenom. Snake bite. If bitten by a snake, try to remember as many details as possible of what it looks like. Do not try to catch the snake. Symptoms of a snake bite include bite mark, swelling, and pain. Wash the wound, keep bitten area still and lower than the heart. Call 911 for medical attention. Ticks and LYME'S disease. If a tick is found, grasp the tick with fine-tipped tweezers close to the skin and pull slowly to ensure that the head does not break apart from the body and remain in the skin. If the mouth parts remain embedded in the skin, get medical care. Wash the bite area with soap and water and apply an antibiotic ointment. The telltale sign of LYME'S disease is a red bullseye on the skin. LYME'S disease responds better with an early diagnosis. See your doctor if you think you have been bitten by a tick and are at risk. Allergies. Allergic reactions to certain foods and bee stings can cause severe swelling of the face and air passages, restricting breathing. Symptoms of an allergic reaction include difficulty breathing, feeling of tightness in the chest and throat, swelling of the face, neck, and tongue, a rash, hives, dizziness or confusion. Benadryl is available in all first aid kits. This medication will decrease a minor allergic reaction. It will make you sleepy, so avoid taking it if you have a long drive home. It is also not recommended to continue with your volunteer time for the day after having taken Benadryl. If a person has a major allergic reaction, 911 should be called. People who know they have allergies may carry an EpiPen with them. Poisonous plants. Poisonous plants common to Florida found at the sanctuary that cause skin irritation include poison ivy, Brazilian pepper, croton, elephant ears, philodendron, and oleander. Poison ivy especially causes acute symptoms in 50% of people, including severe skin redness, itching, swelling, and blisters following direct or indirect contact. If exposure to poison ivy is suspected, clean the area as soon as possible with cool water and soap to remove the oils from the plant. Do not use hot water, as this will open your pores, allowing for the oil to seep in. Minor cases of poison ivy rash can be treated with over-the-counter lotions. These are available in the first aid kits as well. Major cases of poison ivy rash may require medical attention and specific medications. Strains and sprains. R for rest, I to immobilize, no splints. C, compress. Ace wraps are available in the first aid kit in the gift shop. E, elevate. Ice can be used to decrease the swelling. Ice should be applied to the affected area for 20 minutes, then removed for 20 minutes. This cycle should be repeated as needed. Do not apply heat to the area for the first 24 hours. Sudden illness, seizure, diabetes, etc. Seizure. Clear the area to keep the person from injury. Do not try to hold down or put anything in the person's mouth. Turn on the left side when seizure is over to prevent aspiration of vomit. Diabetes. A sharp drop in blood sugar levels can manifest as sweaty, shaky, confused, sometimes belligerent. Give fruit juice, Coke, not diet, or candy. The guest or volunteer will usually have something with them. There is water, Gatorade, and snacks for emergency purposes in the gift shop. Stroke. Symptoms of a stroke include loss of movement and or sensation to one side of the body, facial droop, confusion, vomiting, and loss of consciousness. If the person is unconscious, does not have a pulse, or is not breathing, call your coordinator. The coordinator will call 911 and have someone retrieve the AED and begin CPR if trained. Ambulance, walk-in clinic, emergency room. Ambulances should only be called for in a true emergency. For all other non-serious injuries and illnesses that cannot be treated on-site, the person should be taken to a walk-in clinic or hospital. Volunteers should be taken to the walk-in clinic or hospital by a staff member. Instances when 911 will be called are heart attack, stroke, drowning, loss of limb, hemorrhage, uncontrollable bleeding, and venomous snake bite. Special note: it is preferable that if a volunteer, intern, or staff member needs to go to the walk-in clinic or emergency room, they should change into a non-BCR shirt prior to going. It is a good idea to keep a clean, non-BCR shirt in your car or with your belongings for such an occasion.